Next on the bacterial STD list is syphilis. Now, syphilis, like I said, is bacterial. It's a bacterial STD. It can be found in the anus, the mouth, or the genitals, and it can be transmitted through intercourse or when a mother gives birth to an infant.
Syphilis has progressive stages, and they usually have a single small painless sore, or you can develop a non-itchy skin rash all over your body or on your specifically hands and feet. And many people don't notice the signs or symptoms for years.
A single injection of penicillin to the muscle, intramuscular injection, should clear it up well, not right away, but it should be suffice.
And according to the CDC, normally syphilis is a homosexual disease, so they have been accounted for most of the cases of syphilis.
Now, that wraps up the bacterial portion of our presentation, or our show today, excuse me. Now, heading over to the viral. The first one on the list is herpes. Herpes, like I said, is a viral STD. It can be found on the mouth or the lips, and it's transmitted through oral sex or simply by kissing someone else who has herpes.
According to Medline Plus, herpes are usually you usually get outbreaks, you usually get sores near the area wherever the virus entered. They become very itchy and painful, and they usually heal, and they occur basically all the time. The virus can be serious in newborn babies and people with very weak immune systems.
I regret to inform you all that as of yet there is no cure for herpes.
And there actually isn't really any statistics about it, because a lot of people that have herpes don't go to the doctors because it's normally just like a cold sore. So they assume it's just going to go away. So there's no stats about it.
Exactly. Well said. Well said. So the next one now, hepatitis B. Hepatitis B is viral as well. It targets the liver, and in this picture right here, this is actually a woman. She's not pregnant. Her liver. This is hepatitis B and what it can do to you. And it's transmitted through blood or other bodily fluids.
Hepatitis B, many people affected with hepatitis B don't usually go get treatment, only because it's very similar to the flu. So basically they have nausea, stomach cramps, vomiting, and diarrhea. And 30% of people don't even know that they have it.
No cure, again, my apologies.
There are ways of vaccination for it if you're younger, but normally if you have it and you don't get the vaccination before it, nothing happens.
All right, now to round this off, HIV and AIDS. HIV is a viral STD. It targets the immune system, as we can see here. This is kind of wide and so slender. And it's transmitted through bodily fluids, intercourse, even sharing needles, and also by a mother giving birth to an infant.
As the infection progresses, people with HIV grow increasingly susceptible to illness. Even though many of these illnesses can be treated, those with HIV have a very weak immune system. Before HIV progresses, it turns into AIDS, and the symptoms for HIV is chronic yeast infections, fevers, night sweats, easily bruising, exhaustion, unexplained body rashes, purple lesions, and sudden unexplained body loss. And as it turns into AIDS, you get pulmonary tuberculosis, toxoplasm of the brain, severe bacterial infections, invasion of cervical cancer, and lymphoma.
Sorry to jump the needle, Doctor. As of yet, there's no widespread cure. However, doctors have had some minor success in curing one subject in Britain using genetically engineered stem cells that were genetically engineered to be HIV/AIDS resistant. There may be some mitigating circumstances that requires further testing, but there may be a cure on the horizon. So there is hope.
African Americans are more than likely the ones that get HIV and AIDS. The most cases that happen with HIV are between the ages of 20 and 24.
Alright, so that kind of rounds off the presentation. Trevor, do you have any preventive cures for us and preventive measures?
As a matter of fact, I do.
Alrighty, let's do it then.
Why not? Well, as you all seem to be aware, condoms are, of course, a good way to reduce the risk. They don't reduce it entirely, however, but they do reduce the risk of getting some STDs. Dental dams can also help, and if you're not familiar with what dental dams are, it's a thin sheet of latex that you use for oral sex. Dentists actually use it when they're performing minor tooth extractions and whatnot. And it can help reduce the risk as well. The only really 100% foolproof way, though, of never catching an STD is to abstain from sex. Which is not what I recommend. I know that you are all college students. I myself am a college student who is pretending to be a very, very strange doctor at the moment. But what I do recommend is just not taking any unnecessary risks. One-night stands, not a good idea for your health. I mean, you only get one body and you're going to have to live with the results of your actions the rest of your life in some cases. Thank you.
Yeah, see, kind of y'all, I don't mean to put you guys out, but I'm the doctor here. You know, you guys kind of turn your heads, you know, whatnot. But, you know, what he says about the one-night stands, that's true, you know. I mean, just be careful what you do. We're not telling you how to live your life, how to not, you know, be absent or whatnot. We're just giving suggestions on what to do. All right, yes.
And the last, but not least, is the power of communication. Speak up. If this affects you, if this affects someone you know, speak up. Make them, we can't allow, if there's one thing we cannot do, we cannot allow it to hide under the proverbial table. If it hides under the table, there will never be a cure for any of this. It needs to become a public issue because it is a public threat, and unless the few people stand up and become the many, the doctors aren't going to find a cure. They're not going to have any motivation. It's up to you. It's up to us. Good luck.
All right, thank you, Dr. Humorous, for, you know, busting the table up and the wonderful knowledge. All right, so this will bring us to the final point of which we will talk about, and that's the fifth concept acknowledged by Warner Fast, and that's relationships characterized by frames. Now, sitting here and listening to us speak and maybe rant to some of you about STDs and preventive measures and all this, you know, possibly, maybe, you know, you might have formed a relationship with us. Maybe not one as strong as your best friend, boyfriend or girlfriend, or a close family member, but, you know, the relationship is still here. So what I'm trying to say is that maybe now we've opened doors for communication. Maybe not with us, but with, you know, the ones that you're close with. So this door that's now open can lead you, so let's, I'm not saying that you guys do, but if one of you were to have an STD, then you could talk to someone about this, and it would help with the censorship of, you know, feeling not alone. Or now that you know more of this stuff, maybe you can go and talk to one of your friends or someone you know that may have an STD about this concept, and, you know, so they won't feel alone going through the process either. So no, we know that STDs are a very serious topic and that they need to be treated even seriously, or even more serious, excuse me. So our purpose today was to not come up here and, you know, just keep ranting like I said before, but we just wanted to maybe give you more knowledge if you didn't know some of the stuff already, or perhaps, you know, refresh some of the knowledge that may have slipped in the back of your mind. So what we ask is that you guys gain, or you guys, you know, consider everything we've talked about, really grasp one topic, one piece of information that you may think is the most important, and that if the opportunity presents itself, that you use it. So our time's just about up, Doctor. Hate to apologize. So thank you once again for joining us on this episode of The Doctors, and we look forward to seeing you.